I'm here to talk about risk assessment in peri and postmenopausal women. So risk assessment, few questions came to me when the topic given to me, what is risk assessment? Does it require special skill? How to categorize the risk for the disease? What are the stages of risk management? What are the strategy to reduce the risk? So risk assessment is just that apparently a healthy individual, asymptomatic individual, based upon certain variables, we assess the risk. It doesn't require any special skills or a complicated technique. So it is based on numerical estimate, and so that we know the probability of the risk. So risk can be high, medium, and low. And stages in risk management, we can identify the risk, evaluate the associated risk, and we can control the risk. So why the risk assessment is important in midlife and beyond? Because that is an ideal time to think and evaluate their health, and ideal time to assess health risk so that they can enjoy quality of life later on. That is the investment. We do it at midlife, actually even before, right from adolescent we have to invest. So our life expectancy is increased, there is a shift in midlife duration, and it serves as a preparation for later part of life. So as you all know, there is a transition, and it is a natural protection so that the estrogen is changed to estradiol to estrone. And during that time, we are alone also. And there should be the optimum health bell curve. The level of estrogen should not be too low or too less also. So in perimenopause and menopause, we all know the estrogen withdrawal. We have the modest list of all the complications. The long term will be the coronary artery disease, osteoporosis, and cognitive function decline. And 1/3 we spend in postmenopausal period. So there is a risk assessment tool, both offline and online. Say a simple BMI chart that predicts and visceral obesity and risk assessment. There is a chart by WHO, and muscle health is assessed by SARC-FA 5-item questionnaire, and online there is a breast risk assessment, that is a Gale model, and WHO is a fracture risk assessment specific to the country. There is both, these are all the things we are supposed to do routinely in our clinic. So the BMI is categories, the Indian BMI category is little different. So the management also, we have to intervene. The active, that is the WHO, the waist circumference should be more than 72, we have to avoid weight gain and lose weight. More than 80, we have to supervise management, we have to give. These are all can be done as an offline. So we have a very good tool, menopause rating scale, and it is 11 questionnaire is there, and it is divided into 3 categories, somatic and psychological. The somatic include hot flush, discomfort, palpitation, psychosomatic, depressive mood. It's a question 0 to 4, and it is rated as 0 to 4. It can be a mild, moderate, and severe. So that can be that. This is the thing which we can keep it in our desk, so that to the presence or absence of diabetes, 2 variants are there. We can assess if it's one side, if there is a age, the other side we can give whether it's a mild or moderate. So for example, she is 44 years, and BP is 110/70. Her total cholesterol is 310. That should be converted to millimole, and across you can see she belongs to 20 to 30% of risk for cardiovascular. So before we can prescribe MHT, these are all the tools we can use offline. So WHO, they have devised another nomogram with or without diabetes also. So CVD risk, there is an app available. It is the predicting risk of cardiovascular disease events. It is called Prevent Calculator. All that you have to put certain questionnaire answer that will give the risk. It is devised by the American School of Cardiovascular System. And OSTA, you can know, that is a simple calculation. Again, we can place it in our office, so that whether the red, the green, it is no risk, moderate risk, and high risk. when it falls, based on the age and the weight. It's all very simple tool, we can predict osteoporosis. See, her age is 60 to 64, her weight, so weight is 61 kg, so she belongs to low risk. So this is the thing I was talking to you, few questions, 5 questionnaires, the strength, how much difficulty they have in lifting or carrying the 10 pounds, and assistance in walking, rise from a chair with or without support, and climbing the stairs, and whether there is a history of fall. So based on that, we can assess the sarcopenia. And online fracture risk assessment, it is a FRASC score. Without or with BMD, we can assess the risk. The score refers to the fracture in hip, arm, and spine, and 10-year risk it shows. And another breast risk assessment, it is also online. We have to feed in the age, the race, age first, live birth she has given, family history, all that. So it will give a data, and based on that, we can classify them whether it's a low, moderate, or high. So we have, actually this was designed by me. It's a midlife and beyond app, compatible with Android phone. All this risk which I was talking to you, menopause rating scale, OSTAR, fracture risk, sarcopenia, cardiac risk, breast cancer, everything, when the patient is coming, if you feed certain data, it will give you. And it comes in PDF also. This is how it comes, all the thing, it will come, so that it's easy for us to counsel and prevent certain things also. See, if she has more of psychological problem, it's easy for us to counsel. All that it is categorized into whether it's a psychological or somatic. So it's all available in Google Play Store, free of cost, no advertisement. So what strategy we have to do? Suppose she has got 20% cardiac risk. Of course, we heard a lot in length. The previous speaker was talking, lifestyle modification, of course, calcium, vitamin D supplementation, appropriate medical therapy. If she found to have a risk more than 40, we have to refer to the physician. And if they have symptom, hot flashes and other things, if there is no contraindication, we have to give them menopausal hormone therapy. And sarcopenia is there, we should teach them fall prevention strategy. Why we should do the risk assessment? It improves overall quality of the care, encourages awareness, enhance physician and patient relationship. When we talk to them with the risk in your hand, it's easy to counsel. They have a better trust in you, and dispel misperception, always unwarranted fears, whether I'll do this. It's very easy and provides basis for discussion. When something is in our hand, it's very easy to this thing. So the women are the pivot of universe, are axle around whom the family, society, maybe the whole universe is revolving. So her health is utmost importance at all stages of life, more so in midlife and beyond. So risk assessment in peri and postmenopausal is a potential tool to prevent chronic disease. Prevention is the duty of every gynecologist. So let me conclude with this: fit at 40, strong at 60, independent at 80. So women's health is the nation's health. Thank you for patient listening.